Ulcerative colitis and Crohn's disease. We can see what is the difference between ulcerative colitis and the Crohn's disease. It's a common question in exams, right? So we can see that both the ulcerative colitis and the Crohn's disease is an inflammatory bowel disease under the category of IBD, inflammatory bowel disease. Ulcerative colitis, the name itself, it specifies that it affects the colon. Okay, so large intestine will be affected in ulcerative colitis, inflammatory bowel disease causing inflammation and ulceration in the innermost lining of the colon and rectum. So the ulcerative colitis, it affects the inner lining of the colon, especially colon and rectum. In Crohn's disease, it's also inflammatory bowel disease causing inflammation and ulceration occurs in entire GI tract. That is the difference. Main difference is the ulcerative colitis, it affects the large intestine, but Crohn's disease affects the entire gut from the mouth to anus. So next point, location of inflammation. Location of inflammation we already discussed, that is it affects the large intestine and rectum. But Crohn's disease, entire gut, that is from mouth to anus, it affects any part of the gut. Next one, pattern of inflammation. The ulcerative colitis is continuous and there is no patchy layers or no scattered. The ulcerative colitis, it is continuous but it is not scattered or no patchy layer. But here in Crohn's disease, the patches of inflammation is found in large sections. It is not continuous. There will be patches of inflammation in a large sections. That is the Crohn's disease. Then appearance and location of pain. The ulcer in ulcerative colitis, it affects the inner lining of the abdominal layer. That is the mucosal layer will be affected in ulcerative colitis. But in case of Crohn's disease, the entire layer of the gut will be affected. So that's why it penetrates entire thickness of the abdominal lining. So entire layers of the gut will be affected in Crohn's disease. So the fibrotic changes will be more in Crohn's disease. That's why cancer occurrence, that is more in Crohn's disease than the ulcerative colitis. In ulcerative colitis, there will be mucosal thickening. Okay, first layer will be the first layer of the gut will be affected, or the first layer of the inner lining of the abdomen is affected. So that is the mucosal layer, right? So mucosal layer will be affected. That's why mucosal thickening is a complication, or mucosal thickening is present in ulcerative colitis. In Crohn's disease, due to entire layer is affected, that's why there will be fibrosis is very common in Crohn's disease. And regarding the pain or location of pain, typically lower left abdomen will be affected in ulcerative colitis. And here there will be mild to moderate pain for the person, ulcerative colitis person. There will be pain and usually it affects the lower left quadrant. But in case of Crohn's disease, the person will have moderate to severe pain and it is a cramping in nature and it affects lower right quadrant. Then regarding the bleeding, the symptom of bleeding, bleeding is common in ulcerative colitis. But in case of Crohn's disease, bleeding is not that much common. Bleeding may occur, but it is not common. Then regarding the signs and symptoms, bleeding during bowel movements, urgent need to defecate, loss of weight, then severe diarrhea, formation of polyps, abdominal cramping. These all are the signs and symptoms of ulcerative colitis. In Crohn's disease, there will be mouth or GA ulcers, loss of weight will be present, severe diarrhea, fissures, anal bleeding, abscess, fistula, strictures, abdominal bloating. All these features can be seen in Crohn's disease. Crohn's disease. Okay, so in ulcerative colitis, we can do a surgery as a management. But in Crohn's disease, if we are doing surgery, there is no that much use. Okay, so surgery is a good treatment for ulcerative colitis. But in case of Crohn's disease, it is not that much necessary. Okay. So that's regarding the difference between ulcerative colitis and Crohn's disease. I hope you understood. Thank you.